Hi everyone, welcome back to the Hello Fam podcast. I'm your host Shalini, and I'm excited to have you all here with us today. First off, I want to share some exciting new updates regarding the app. We've just launched our latest app, Hello Fam 4.3, with an updated assessment to share better with your loved ones after you complete the assessment. And to stay up to date on our latest features, please make sure to follow us on LinkedIn and Facebook. And we also post on social media, so follow us at hellofam.app on TikTok, Instagram, and YouTube. Now back to the podcast where we talk with our longevity doctors, key opinion leaders, and others onto their views into longevity. Our goal is to provide you with greater insight into the world of living long and well, as well as learn some practical tips to incorporate into your daily lives. And today's guest is a key opinion leader, so join me in welcoming Dr. Mekhala Chandra.
Hi,
So,
Shalini.
hi. Thank you for taking the time out of your busy schedule, of course, to meet with us today. I guess just an introduction about yourself. Can you give us a little background, how you got to medicine, Hello Fam, as well as any hobbies and interests you have outside of this doctor setting?
Yeah, sure. So I am an internal medicine physician by training, and I did my residency at San Francisco, CPMC. And since then, I had practiced in hospital-based medicine. So I did a lot of wards and then ICU, and then of course COVID hit. And like any other physician, was like super burned out, seeing all the death rates. And so I kind of wanted to move to something called as preventative care. So I pursued my fellowship in obesity medicine. And since then, I've been practicing obesity medicine and, a lot in longevity too.
That's awesome and incredible shift. I know it gets to be tough, especially after COVID and as a physician. And we talked about physician burnout actually in a previous podcast. So yeah,
That
I
is
hope we're,
real. Physician burnout is real.
I
And
know it's, yeah. Continue.
besides that, just like working full time, I am also a mother of two kids, young kids, so they keep me busy. And hobbies, honestly, I don't have time for hobbies anymore, but I do enjoy cooking. And, so that's kind of like my way of just enjoying life and, yeah, making like healthier choices right at the kitchen.
Yeah, of course. It always starts right at the kitchen, what you can control. Thank you so much for sharing, and I hope our listeners are excited to learn more about you and your interests. So let's dive right into discussing Hello Fam's mission, increasing longevity. So we ask all our guests this, what is your definition of longevity and what does it mean to you?
So longevity is a burning topic, and I think it's a very misunderstood topic right now. People think longevity means, just to live longer. Now, if you trace it back, there are enough myths about it, including, like your fountain of youth that people had found in the Greek mythology. But what it really means to me, at least from a medical perspective, is when your body like stops the homeostasis, like the process of that. And that ultimately leads to, slower metabolism and then getting prone to diseases. So for me as a physician, longevity is to live your life disease free. Of course, we've added years to it because we have like such advanced research. We have like great doctors, great professionals everywhere. But just adding number to a life does not mean longevity. It means, for me at least, that it's whatever years you're living it as disease free, and hopefully to like the maximal potential of a human body, both mentally and physically, and that would be a true definition of longevity.
That's exactly, I love it. That is exactly what our goal is too at Hello Fam. It's to add healthy years to life, not just years. So
Just
thank
years.
you for sharing your understanding of it. So moving on to your expertise, fatty liver and metabolism, I guess starting off, what is fatty liver and what are recent trends in diet and exercising that are contributing to its growth?
Sure. So as an obesity medicine specialist, I see a lot of patients who are underdiagnosed. Fatty liver disease now is a disease that is finally recognized. Honestly, we're in middle of this revolution. All the definitions are changing. Your clinical criteria are changing. There's too much advancement in management and treatment. So this is an exciting phase to be, at least in this particular field. Um, and we talk about diabetes all the time. We talk about like high blood pressure. We talk about high cholesterol. But very recently, have we started talking about fatty liver disease? And there's enough research to show that fatty liver disease, in common language, is they have this. It has the same risk factors as a cardiovascular disease, which means like things like obesity or overweight, things like diabetes type 2, hypertension, high cholesterol, especially high triglycerides. They are same as risk factors as for cardiovascular disease. So now it is estimated that 25% of American population has this disease. Now, coming to the medical terminology of it, it's not known as fatty liver disease anymore. It's known as MAFLD or MASLD, depending on the stage you're on or at. And basically, what it means is a metabolic dysfunction associated liver disease. And there's different stages to it. Most of us would fall in grade 1 or grade 2, which is in common language. But if you look at the pathology side of it, it usually falls in, like how do I say that? Steatohepatitis. Um, we're gonna pause this one. Um, So most of us will fall in grade 1 or grade 2 fatty liver disease, which in pathology terminology means MASLD, which is metabolic dysfunction associated steatotic liver disease, which, to break it down, means that there is fat deposition in your liver cells. And if this keeps progressing, then those liver cells becomes eventually like scarred, which we call as fibrosis. And then sooner or later, they end up dying and having more scar tissues, which ends up in cirrhosis. So if you look at, the progression of disease, it'll go from MASL to cirrhosis within few years. The estimated lifespan is 10 to 15 years for this particular disease.
Wow. And then again, going along with other fatty liver diseases, there's something called NAFLD, non-alcoholic fatty liver disease. What are possible warning signs for NAFLD? Because as I did my research into it, it has no obvious symptoms and its cause is relatively unknown. So are there tests the general population should be taking to prevent its progression and diagnosis?
Yes, absolutely. So MAFLD, which you just called as NAFLD, again, the definitions have changed a little bit. So MAFLD basically is asymptomatic, which is mainly your grade 1 or grade 2 that you'll see. However, it does have subtle signs, signs of like, fatigue, signs of just not to the optimal energy levels that you would be, bloating, indigestion. These can be subtle signs. Obviously, they can be from multi other, causes, and so often missed. Um, but people who are at risk factors, like I said, more obese or overweight, especially central obesity, if you look at what we call as belly fat, so more, Asian Indians are more prone to that than Caucasians. So they are at a higher risk for developing this disease. And so that should be always in the radar of any physician, whoever's diagnosed with any kind of metabolic syndrome, which includes your, new onset of diabetes or pre-diabetes, your new onset of high blood pressure, or if you have abnormal cholesterol, LDL, high triglycerides. So you should get checked for fatty liver disease.
Okay, so general lab tests will be able to indicate as any unknown or higher than normal levels.
Yeah, so the common lab test that we end up using is, of course, we start with the liver profile, which is, like liver function tests. ALT can be abnormally high in that. Some physicians can use the scale of like AST-ALT ratio. Of course, it doesn't have very true predictive value, but if it's less than 1, then we consider it related to metabolic syndrome. If it's more than 1, or especially 2, the ratio, then it's more towards like alcohol liver disease. Of course, the alcohol liver disease was known to be the most, positive agent for liver failure. But now there's a shift in this, and MAFLD is now the primary reason for those. So it can lead to hepatitis eventually, it can lead to cirrhosis, and ultimately it can lead to liver failure.
Oh, wow. Okay. Thank you for the explanation. And then I guess going along in the context of longevity and aging, To treat metabolic diseases, physicians always stress diet and exercise. But what does that exactly entail as you age? Does it require drastic change or small changes depending on a person's demographics?
This question has like so many answers to it. So as we age, we know that our metabolism can decrease. May not be true for everyone, depending on how long and how healthy and whatever your habits are. It does depend somehow on your genes too and where you're from. But as I said, longevity is kind of stasis of homeostasis, right? So you're not burning up that much fat. You're not, feeling that much energetic. So it's just this chronic delay, and so we relate it to aging. But to come back to the fatty liver disease, it can be still reversed if you catch it in early phases, which is grade 1 and grade 2. And exact treatment of it is honestly weight loss. So if you can, kind of control your risk factors, and a major one again is weight loss, it can be reversed. It takes like about 3 to 6 months if you're doing everything right. If your cholesterol is, well controlled, if your sugar levels are well controlled, this disease can be reversed.
Interesting. And I guess we're going to move on to your other area expertise, talking about vitamins and supplements. What would you consider to be a vitamin that is often overlooked in the everyday diet?
Um, so, you asked me earlier also about the diet, the role the diet plays. It, I feel like diet is 70% of what we are. If your diet is right, there's an ancient saying, if your diet is right, you don't need medicines. And unfortunately, in today's era, our diets are completely, full of processed food. It's completely full of instant, like microwave food. And, now we're going back to organics and like trying to get that full vitamin load in there. But we still, because of how we have abused our gut for so long, we do suffer a lot from malabsorption syndrome. And now there's a shift again about like gut health, and these are the terminologies you'll hear right now. But what it really means is that because of this, like kind of this nasty food that you've been eating for years, knowingly or unknowingly, because they're packaged foods, they're processed foods, you wouldn't know. Most of them are, like company gimmicks too. We have destroyed our gut flora, and because of that, there's a lot of malabsorption, especially of essential vitamins and minerals. So coming back to your question, one of the most common vitamin deficiency that we see is vitamin D. It is a very vital vitamin. Contrary to the belief, it's not just for bones. It actually helps in maintaining and building your muscle mass too. The reason we are so deficient in it, and this is worldwide, more so, of course, in, Asian population, we are deficient in it because we just don't absorb it. And then our livers, coming back to liver disease, fatty liver disease, are already, unable to convert that vitamin to its active form. And so you see a lot of patients coming up with vitamin D. And, the signs and symptoms are very subtle. They'll come with like fatigue, muscle cramps, bone pains. And of course, in severe forms, it can be rickets or osteoporosis, depending on the age group. But it's a very vital vitamin because if you can replete it to the optimal value, then the energy levels, your everything like your hair growth, your muscle mass, your bone steadiness, it's drastically increased. And always with it comes something called as magnesium, which is extremely necessary for absorption of vitamin D2. So a lot of my patients, I prescribe magnesium at night for sure, and that indirectly helps in vitamin D absorption. And depending on the levels, if they have insufficiency or deficiency of vitamin D, it's replaced. But the idea is that it can be maintained through the right diet. And most common sources of vitamin D you'll see are eggs, like mainly egg yolks. Mushrooms are pretty good sources of it. Fortified milk. And then nuts, walnuts are a pretty good source too. So, eventually we should bring in those things so we can maintain our vitamin D levels. but it may need initial replacement with medical therapy too.
Definitely gonna add those onto my grocery list because I understand the looking into vitamin D deficiencies. It's very common in the population because it is. You don't realize what sources actually give it to you, so you need to include more vitamin D rich foods. And then going again with supplements and vitamins, there's a lot of information on the internet about certain supplements and which one is the best, along with phony claims of a miracle supplement. So, in your understanding and expertise, what are the main things people should look for when they go out to buy these vitamins and supplements? Should it be about mainly ingredients, organically sourced, or is there another label that we should look for?
Shalini, that is such a tough question to answer because, these supplements and vitamins are not FDA regulated. So, what we can, okay, so we come from a different background. We may have a better understanding of the ingredients, but for common man, it is as confusing as it gets. And honestly, a lot of it is about marketing and how the company is placed on the shelves of your Costco or your other grocery stores. But what you're really looking at is the ingredient and the nutritional value attached to it. So, for example, if you're going to buy a magnesium supplement, you want to look at the value of it. It has to be around above 200. Speaking of another common supplement which stays is probiotics. So as long as any probiotic meets a certain criteria of more than 1 billion bacterias, and like there's different types of bacterias that they'll advertise. And there's only 3 or 4 key bacteria that you're honestly looking for. You're good to go. It doesn't really matter which company it is. It doesn't matter what cost it is.
Thank you for sharing your advice about what to look out for in terms of vitamins and supplements. So, we are nearing the end of the podcast. So, as a last question, I want to ask, what piece of advice would you give to every patient out there?
Sure. Thanks, Shalini, for that question. So, we talked about like fatty liver, talked about why. So one thing I want every patient to know that there's a lot of misinformation out there. But when you do start your weight loss journey for whatever reason, fatty disease or diabetes or other metabolic syndromes, please understand that every weight loss journey is very, very personalized. Your metabolism, your age, genetics, your other history matters. And so whoever you're like consulting, whether it's a dietitian or a doctor, your plan has to be extremely customized according to your lifestyle, according to your disease spectrum. So what I would say is do not follow that misinformation that's out there on social media. See a professional and try to follow that and get a custom plan.
Thank you. And I hope all our listeners have enjoyed listening to all the great advice and suggestions that Dr. Chandra has given us. And thank you so much for joining us today for the podcast. And I hope you have a good rest of your day.
Thanks for having me, Shalini. It was a pleasure.